Hello, I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually talk to patients about their weight all the time. I actually prescribe these medications all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicine, and if you want medically based answers to your weight questions, you are in the right place. Welcome. I'm not hungry and eating 1,000 to 1,200 calories a day, weighing everything and tracking macros. I could probably eat more protein, averaging 40 grams per day, but I'm just not hungry. I'm forcing myself to eat when I am. However, I've not lost weight for 2 weeks now. I'm on week 6 at 2.5 and haven't gone up because I'm already not hungry. Should I increase the dose simply to lose, not having any side effects? Okay, this is a great question. I think you are having side effects. One of the side effects being your appetite is really suppressed. So if I have a patient and they are really not hungry at all, they feel like they're really forcing themselves to eat, and it's really kind of a slog, like maybe they had a normal appetite before and now they're like, whoa, I really just eating is a big chore for me now. That is somebody that I personally will titrate slower. And remember, the goal is that you are able to stay on these medications. My goal for patients is that they are able to manage these medications safely over the long term. And I know my patient is not going to care in 3 years if it took them 6 months or 9 months to get to that high dose. What they will care about is, was I able to take the medication or did I have to stop? Did I have a lot of health issues from the medication? So if I have somebody, their appetite is really suppressed and maybe they also stopped losing weight, especially on those lower doses where I'm not expecting a ton of weight loss, that is somebody that I will just say, you know what? Let's keep you here until your appetite gets a little more normal, because that's somebody that I'm going to be afraid if I bump them up a dose to help them lose more weight, that they're going to have even more side effects. They aren't going to want to eat at all. Maybe they get really nauseous. Maybe we have to start supplementing with shakes. My goal for people on this medication or not on the medication is that people are eventually able to eat when they're hungry and stop when they're full. And I want people to have an appetite. So if I had somebody that's really suppressed, I am going to just hit pause on the weight loss and make sure we get them to where things are a little bit more normal. They're tolerating the medication a little bit more, because I can always go up on their medication, but the quality of life and nutritional status is very, very important. And it's not a race. So that's usually where I stand with people. Sometimes I find that weight loss is important, but it's not always the top goal at all times for my patients. Of course, their safety and their comfort and their quality of life are also extremely important. And so it's always, where is the patient? How are they doing? I will get them where they need to be eventually, and but I want them to get there safely and as comfortably as possible, because things only really work if we can sustain them. So what a great question. As always, if you have a question, you can leave it on this video or on another video. If you want to work with me directly, I do work with people as a life coach to help with the non-medical aspects of weight loss. So if you're somebody who's on a medication, but you're like, I still have a very difficult relationship with food, it's kind of a hot mess, I need guidance, or you can't get yourself to the gym, or you're not on a medication, you really want to try to not be on one in the future. These are just some of the many topics that I help people with. So if you're interested in hearing more about that, I will put a link down below. We can definitely chat about it. If you're not subscribed to this channel already, subscribe, because it's the place for medically based answers to your weight questions. Thank you so much for watching, and please be well.